Chapter 7, Male Reproductive System. Okay, some terms that are built from word parts. Anarchism. Ism means a state of, and means absence, and orchi means testes, so that's the state of absence of testes. Benign prostatic hyperplasia. We see it very commonly abbreviated BPH. Breaking it down, benign means it is non-malignant. And then when we look at hyperplasia, that means an excessive development, growth, or formation. And what happens here is as males age, they quite often will have an abnormal increase of cells in the prostate, which causes it's a result of the change of tissues here, enlarges the prostate, and then as a part of that enlargement, they develop a narrowing of the urethra, and that interferes with passing of urine, causes symptoms such as frequent urination, nocturia, retention of urine, and difficulty in emptying the bladder. The correct terminology is benign prostatic hyperplasia, but you may also see it referred to as benign prostatic hypertrophy. Epididymitis. Itis we know means inflammation. Epididymo means epididymis, so it's an inflammation of the epididymis. Prostatocystitis. Inflammation again means inflammation. Prostato means prostate, and cysto means urinary bladder. So we know this is inflammation of the prostate and the urinary bladder. Prostatolith. Lith means stone, and prostato means prostate. So this is a stone in the prostate. And now the words that are not built from word parts. Erectile dysfunction is the inability of a male to attain or maintain an erection. And there was an earlier term used more commonly that is called impotence. That term has kind of gone by the wayside, and so now we've referred to that more commonly as erectile dysfunction. A hydrocele is a fluid-filled sac around the testicle that causes swelling of the scrotum. Phimosis, and note here the pH is pronounced as an F, so this is phimosis. It's a tightness of the prepuce of the foreskin, and it prevents the foreskin or the prepuce from retracting over the glans penis. Prostate cancer is a cancer of the prostate. We see it typically beginning in about middle age in males into to older males. Testicular torsion is a twisting of the testicle, basically. The result of that is decreased blood flow. We see it quite often in that puberty time frame for very young males, and it is considered an emergency situation. Okay, surgical terms built from word parts. We have balanoplasty, which plasty means surgical repair, and balano means of the glans penis, so this is surgical repair of the glans penis. Orchiopexy. Pexy means surgical fixation, and orchio means testes, so this is surgical fixation of the testes. Prostatectomy. In this case, ectomy means excision. Prostate is prostato, so this means an excision of the prostate gland. And it can be done in two different variations. One's more involved procedure than the other. And then our last term here is vasovasotomy. So in this case, this is creation of an artificial opening. This is the ostomy. And then the procedure is actually in order to try to restore fertility to men who have had vasectomies previously. Okay, and now we'll look at some surgical terms that are not built from word parts. The term ablation means destruction of abnormal or excessive tissue by melting, vaporizing, or eroding off of the tissue. Laser surgery is a procedure where a focused beam of light used to excise or remove, vaporize abnormal tissue and control bleeding. And this is done quite often. We refer to this as laser surgery. It is a less invasive procedure typically. Transurethral incision of the prostate gland. In this case, it's a surgical procedure that widens the urethra by making a few small incisions in the neck of the bladder and the prostate. So this is this is a procedure where incisions are made in this case. A transurethral resection of the prostate, to kind of give a comparison here, it is really the surgical removal of pieces of the prostate gland tissue itself. And this is done through the urethra. They typically leave the capsule, or what you might look at as kind of the shell of the prostate. And that helps to reduce that problem we talked about earlier with benign prostatic hypertrophy, where the prostate is enlarged. This reduces this to then allow more correct urination and relieve those types of symptoms. In part two of the chapter, we'll define, pronounce, and spell diagnostic terms and complementary terms of the male reproductive system. We'll also interpret abbreviation meanings and look at some clinical context using the medical language. Okay, diagnostic terms not built from word parts. Diagnostic imaging, we'll look at a couple here. Multiparametric MRI. In this case, this is as we know, MRI means magnetic resonance imaging. In this case, it's that type of procedures that gives information about the anatomy, the physiology for staging of a prostate cancer. Transrectal ultrasound. This is an ultrasound procedure that's done to diagnose prostate cancer, or in the effort to diagnose prostate cancer. And of course, since it is ultrasound, it is done by sound waves. Laboratory examples are prostate-specific antigen, very common abbreviation here, PSA. That is a laboratory blood test that's done to measure prostate-specific antigen in the blood, and the intent here is to try to determine if there is the presence of a prostate cancer in this particular patient. Semen analysis is looking microscopically at semen and looking at the size, structure, movement of sperm, and these are done quite often in male infertility cases. We also see digital rectal examination here, and this is going to be a physical exam, where the provider inserts a gloved finger into the rectum and palpates or feels the prostate through the rectal wall, and looking at or trying to feel the size, the shape, and the structure, the consistency of the gland. And they can tell that you hear this done or see this done quite often on patients whenever they have benign prostatic hyperplasia. Some complementary terms: aspermia. A, if you recall, means without. So this is an IA at the end, means it is a condition of. So this is a condition of without sperm, or the absence of sperm. Ogispermia, again, we've got condition. Ogi means scanty, and spermia is going to be sperm, so it's a condition of scanty sperm. Algia. Algia means pain. Orchio means testes, so this is pain in the testes. Terms not built from word parts include artificial insemination, and in this case, This means introduction of washed or concentrated sperm into the female reproductive tract with the intention of trying to treat infertility. So it's artificially placing sperm in the female reproductive tract. Human papillomavirus, HPV. This is in this case, this is a typo on the abbreviation. It should be HPV. And human papillomavirus is a sexually transmitted infection. It is viral, so it's caused by virus. Its most important concern is that it has a high potential of causing benign or cancerous growths in males or females, and these growths are called genital warts. So the concern here is the increase in those kind of problems as a result of the infection of the virus. Puberty is a period when in young adolescence where the secondary sex characteristics develop, and that's things such as pubic and armpit hair. Typically, male voices will start to change at that point, and females develop increased breast tissue. And this is also when they have developed the ability to reproduce sexually as well. Sexually transmitted infection means that it is spread through sexual contact. We see this very commonly referred to as STIs. An old abbreviation used to be STDs for this, but it is now being re-abbreviated to STIs. So it's an infection that spreads through sexual contact. It can be to males or females. It causes a potential of damage to reproductive organs and some other health consequences as well as a potential. Spermicide is an agent that destroys spermatozoa or sperm, and so this is quite commonly going to be a medication type agent in this reference. Abbreviations, and this is only a few again of this chapter, but BPH means benign prostatic hyperplasia. STD means sexually transmitted disease. PSA means prostate-specific antigen. PVP means photosensitive vaporization of the prostate gland. And TUMT means transurethral microwave thermotherapy. Now we'll look at some clinical information and apply some of those terminologies to specifically clinical data. A 62-year-old male was found to have an elevated prostate-specific antigen test during a routine physical examination. At the age of 42 years, he underwent a vasectomy. The patient denies having nocturia or any significant change in his urinary stream. Digital rectal examination revealed a mildly enlarged prostate gland with a 1.0 centimeter stony, hard nodule of the right lobe. The urologist performed a transrectal ultrasound and biopsy. A diagnosis of adenocarcinoma of the prostate was made. The patient elected to undergo a suprapubic prostatectomy. Urinary incontinence complicated this postoperative course, but this lasted for only 3 months. No erectile dysfunction was reported. His prognosis for full recovery should be excellent. And that concludes the PowerPoints for this chapter. As you may have noticed, if you have tried to pronounce the terminologies in this chapter, and this is in my opinion, these are some of the more difficult pronunciation terms. And I think it's simply because of the letters, combined letters that are used. But so I would suggest you practice those some more as you go along so that you can kind of get those down a little bit easier.